but you do not have to sacrifice your orgasms. I don't want you to think that.
I hate to see an orgasm get sacrificed.
Everyone has a right to an orgasm, okay?
Everyone has a right to a good orgasm.
Exactly. You're listening to The Pelvic Freak Show
with your hosts, Amanda Neary and Hannah Meyer. Hey, Pelvic Freaks. Welcome back to another episode of The Pelvic Freak Show.
where you're freaks for us and we're freaks for your pelvis, baby.
If you're watching us on video, Hannah and I are rocking high buns today.
It's a high bun day. It's a high bun Sunday. Ayy.
High bun and red shirts, and we didn't plan it.
Yeah, we didn't. Although I was wearing a red shirt before Amanda got here, and then she changed it to red.
But all I had with me was a red shirt.
That's true.
So I really didn't plan it.
Mm-hmm.
Look at that.
Well, because the other shirt she was wearing was the same one she wore last episode, so she had to change. But this is the thing with video podcasts now. We have to think out of, it takes so much extra steps.
I mean,
I forgot that we need like more clothes.
there's shirts that I wore like early on in the podcast that I feel like I can finally recycle back in.
Yeah, no, for sure. Because our
But
hair is different.
It takes a while because we have different hair, so we can look and we're in a different place.
And we're cooler.
So we get to start the wardrobe over.
Yeah.
Perfect. I'm glad we're on the same page.
Okay, good.
Okay, I have a big update.
Oh, really? Is it bigger than the update I was going to give?
Is yours about the world or about you?
It's about the world.
I'm going to give mine about myself.
Okay, that's more important. Everyone listen to Amanda.
Okay, guys, I just got a new cat. Her name is Bizou. She's a gray, like reverse calico. So she's mostly gray with like white and brown areas and spots. So this is important because my original cat, Stevie, is also a gray cat. She's a gray tabby. Now I only can get gray animals. I have to keep the theme.
Yeah, you can't get a new color.
I can't get a new color. The dog that I get also has to be gray, which leaves me two options because it also needs to be a small freak. So I think I'm going to get an Italian greyhound.
It's perfect.
Don't you think it's perfect?
Mm-hmm. Awesome calls them Speedy Boys.
I love a Speedy Boy. The other option would be like an ugly little gray Maltese, which is my vibe, to be clear. Mm-hmm. But I think the greyhound is like really my vibe.
Well, some people think that greyhounds are ugly, but I don't think that they're ugly. I think they're so cute.
And you put them in sweaters.
And it reminds me of the Jenna Marbles days.
I do think that's the dog I'm going to get.
Mm-hmm. Yeah.
So that's my update.
Yeah, no, I love that. I say Italian greyhound for sure.
Yeah, what do you guys think? Let me know what dog breed you think I should have.
If you didn't listen to our last episode, you know we were talking about how everyone should have two cats.
Two cats, at least.
And now me and Amanda and I, if you will, both have two cats.
If you will. We both have two cats, so what's next?
And Momo and Felix. Momo named after Momo from Avatar: The Last Airbender. Yes, that's correct.
Yes.
Felix named after, that was his name when I got him, and I never changed it because it was perfect.
It's pretty perfect.
And what was I saying there?
I don't know.
I just started bragging about them. Oh, they got the closest they've ever been to cuddling the other night.
Aw.
So
where did Felix go? We were going to put him on camera.
He walked when he walked out of here when we started talking.
Is he a shy boy on camera?
I think he just got annoyed.
He's like, fuck you guys, I'm out of here.
He's a boy, so whatever.
So true.
All right. Well, my update is, so you're filming this in advance. So as of now, when we're filming this is new info. So you guys might be like, yawn, heard it, but whatever. It's a good update. So recently there's been $215 million donation from Melinda Gates to women's health research and just women's health in general globally. And then her donation is mainly focused on supporting contraceptive access and maternal care, as well as initiatives aimed at middle-aged women. And then that includes, of course, further study of menopause care, which was a main focus of her donation. Oh my God, Felix came back.
He came back to be on camera.
He said, this is actually some interesting stuff here.
Felix, you should come over here right now. Felix!
But anyways, Felix, as you must know as well, he's actually coming to see you.
I'm getting him.
You probably could pick him up if you want. And this is my love of my life. And he's 10 years old.
Felix, say hi. They want to hear from you.
If he meowed right now, that would actually be crazy.
I know. We can keep talking about the birth control thing.
Okay, so, and this is important, right? Because, and I'm referencing this article from Associated Press that recently came out. According to World Economic Forum, even though women make up half the population, the health issues that specifically affect them only get 2% of private healthcare funds.
Which is insane.
So anytime we get a new update in women's health or donations to that, we want to talk about it. And this is a headline lately, especially in our world that we're in.
Yeah, Melinda Gates cannot get rid of her money fast enough. She'd just be finding new things to do.
Yeah.
So feel free to put more into this, Melinda. Love when billionaires donate.
So yeah, whenever we see a new update, we want to share, and we'll probably keep doing this, more and more updates as they come in, especially with research as well when we get those. And remember, guys, keep sending us those articles, because when you send us stuff on Instagram, it gives us good things to talk about too.
I think the really cool piece of this is the emphasis on menopause care too. It just is, even in my practice, like in the last 6 months, I'm hearing more about menopause
Way
care.
more.
It's wild.
Perimenopause and menopause care for sure. Which we do have an episode on that last summer that we did with Dr. Samina Rahman, sex med gynecologist in Chicago. And we need to let us know, guys. We're going to do an episode soon more on menopause, perimenopause care for sure.
Episode soon more.
Episode soon more. You guys get it. Don't judge me.
No, they get it. They know how you are.
They don't. I mean, they do.
They do.
Let's move on.
They do. Okay, so today we're going to do a Q&A. I'm really also, can I just point out, like, my life update was the most insane thing ever. And then you're like, okay, here's mine. Women's health research. Like, okay, fine. I'll be done talking about myself. Okay. We're going to do a Q&A today because we have had some really good questions submitted to the pod. So let's get started.
Okay.
How about reasons for lack of sensation during sex? Is that that was a full question?
That was a question. I asked people to submit questions, and
Gotcha.
someone said reasons for lack of sensation during sex. And imagine that in question form.
Yeah. Like, so what are the reasons for lack of sensation during sex? All right. Well, we can start with old reliable pelvic floor tension. You know, when your muscles are tight, it doesn't just necessarily make things painful. That can also limit sensation in that area too, so you can be desensitized.
I love that you just called pelvic floor tension old reliable.
Yep.
But literally because it's so common.
Yep.
For real. It's so common. I mean, it's the number one thing that we're seeing.
I think there's like a big assumption around lack of sensation that there's looseness or lack of tension in the area, right? So they can't feel whatever object or body part is in there.
Yeah.
But it's not always the case. Sometimes you could be quote unquote tight, which by the way isn't necessarily a good thing.
Yeah.
Having sex.
Yeah.
But you could still have that.
Yeah. Another big one that we see very commonly is medications, like SSRIs is a common one. I mean, not only does it lower libido, but it reduces sensation for sure.
Boy, does it.
It does. It can take a much longer time to finish if you're on an SSRI. Let's say your libido, you don't feel like your libido's impacted a lot, but it might take forever to feel like you can actually have an orgasm.
Yeah. And I'll say, because I'm on an SSRI now since November, it took a full 6 months for me to get the hang of the new orgasm routine.
I feel like that's important to say.
Yeah. It can take a long time. So I think the first couple months I was freaking out, and I went back to my psych and I was like, listen, I actually don't have side effects. Mentally, I feel better. I can't come.
Yeah.
That is an issue because I like to have good sex. And
yeah,
that's like a part of my life that I value. And she was like, okay, let's not go up, because for OCD, I'm actually supposed to be on a higher dose, but the 50 milligrams is working really well. So we decided to not go up and see if that symptom would get better over time. And I'm not kidding. This is why I always tell people it takes a really long time to get to know what medication is good for you, because it did take a full 6 months before now I feel like I don't have any inhibition around it.
Yeah.
So now it feels normal.
So this is important. What Amanda's saying is important because commonly people don't know that there's an adjustment period. They just think, okay, SSRI just means lower libido and I'm not going to have as good of orgasms, and that's like stuck in your brain.
Yep.
It's different for everyone, of course, but in Amanda's case and many people's cases, sometimes it does take that adjustment period to where things get better. If this is too personal, let me know, but I doubt that it is. Is there anything that like had to change from previous, or do you feel like the adjustment period just kind of ended, it came to a conclusion and it feels kind of the same, or did you have to change anything?
I will say I am not sure if it would be easier with a partner because I was single when I started and dating. So I was like also having sex with new partners.
Yeah.
And sometimes that's hit or miss. Like sometimes that makes me come faster and sometimes less. And then when I did like sleep with someone who was a little bit more of an old reliable in Q1, let's call it Q1. By then it had already started to dissipate. I don't think I did anything different though.
Yeah.
I think if I was like masturbating, I don't think I did anything different.
Okay.
Definitely vibrators worked better than me like using my hands.
Yeah.
I think it was just less effort and I knew it was going to work, but it did still take a little bit longer.
Got you. Okay.
Yeah.
See, duly noted. Okay. Some other things that could impact your orgasm or your sensation, I'm kind of putting them together, would be hormonal changes as well. We literally just talked about perimenopause, menopause, or let's say if you're going through IVF or freezing your eggs, potentially there could be some fluctuations anytime that you're messing with your hormones, or you're going through a period of time where there's hormonal changes.
Maybe even the time of the month with hormonal changes. I know when I'm ovulating. I don't take birth control, so I know when I'm ovulating because I turn into a feral animal and it just is, everything's so heightened. It's almost like too much intensity. So I know that fades off in other phases.
True. Good, really good point, because I was thinking like big, but you're thinking like monthly changes.
Yeah, like a little cycle,
like cyclical. Yes. And even postpartum, you can definitely experience some lack of sensation, whether it's from perineal tear, scar tissue, and then there's hormonal components there.
Yeah, the not so obvious of if you've been having sex with the same person for a while and that's getting a little dull for you, or your communication isn't on point and you're just not actually as activated or aroused, that can also reduce sensation. Yeah,
thinking of more the psychological component or the mental component of an orgasm or sensation. And then other things would be nerve issues, nerve damage.
Guys, do you see how many things we said before we actually got to lengthened tissue or like too loose of tissue, which really is going to be more of like a weakness, or sometimes postpartum that can happen. That can happen, but it's not always the obvious answer for lack of sensation. But I do get asked that a lot by patients. Like, if it feels less intense, does that mean I'm loose? That seems to be some connotation with it.
Yeah, no, that's honestly what people jump to the most often, but and it is a possibility for sure. It is a possibility. Possibility.
Possibility.
I really think that we hit the nail on the headboard with that one.
We're still doing that in 2026.
I think we are.
All right.
I don't know. Another one I would say would just be like, if we're kind of zooming in, would just be, if you're really stressed.
Yes.
If you're super stressed, if you're at a stressful time in your life or have gone through a big life change and, sex just isn't top of mind, but that kind of goes into the mental health component. So mental health is really important here. Not even thinking, oh, something must be wrong with me. It could really be something just as simple as, it's not simple because managing stress is really tough.
Yeah.
I know times I've been stressed when my cortisol levels were high, and I literally felt like I was floating. Like I felt like I told my therapist, I was like, walking in here, I felt like I was a GTA character, like in a video game, and everyone around me was like NPCs.
Yep.
Because I was just so stressed out.
When you get dissociated.
Yeah.
By your stress.
Exactly. Yeah. Exactly.
Yeah. And even if your answer is simple, like I need to take a medication, that's not always easy. Simple doesn't mean easy. So there's a lot that goes into it.
Yeah, I would say, because it's easy to think, okay, this is different. Why can I not feel this as much? Why is my orgasm different? Sometimes zooming into those, day-to-day things, what part of your cycle you're at, how is your stress? How is your stress management? Things like that first before even there being a bigger thing like pelvic floor tension or dysfunction or nerve issues or anything like that.
Totally.
Yeah.
Nice.
All right. Do we want to move on?
Let's move on.
Okay. So let's move on to our next question. And you don't have the question up, so.
I do, but you can read this one.
Oh, you have it? Oh, okay.
Yeah.
Okay. Nice. Hi, love your podcast and recommended it all the time to my pelvic peeps. Smiley face. I would love if you guys could do a deep dive into quote unquote proper TA engagement and how that ties into things like breath, pressure management, and even daily things like wearing tight leggings. I feel like patients have a super hard time with this and are frustrated because they've been told so many things by so many fitness instructors, social media, etc., and would love to know your favorite cues and tips.
Yes. So for those who don't know, TA means transversus abdominis, which is your deepest abdominal muscle. So you have 4 abdominal muscles that layer on top of each other. This is the deepest. It sits lower in the abdomen. It's a transverse fiber, so it goes across rather than vertical or diagonal like the obliques. And it really is it's a deep core stabilizer. It's a friend of the pelvic floor. It helps offload the pelvic floor. It has a lot of function, especially when you're lifting heavy weights, doing intense exercise. That's why a lot of fitness instructors emphasize this engagement. But if we're talking about our favorite cues, because everyone's body's a little bit different. So I always say it's really hard to cue for this in a group fitness class because you can't go around and like individually feel people's activation or what cues are working for them. So I give fitness instructors the benefit of the doubt there. But in a one-on-one setting, usually people can be a bit more hands-on and find the right cue. My personal favorite right now is if you have to pee and you try to hold your bladder in, like the muscle that you have to lift to pull your bladder in. Like picture it really full, right?
Okay.
Like that feeling of like I'm sucking that part in. It's like lower than you would normally suck in the abs.
I like that. I've actually never used that.
Yeah, I really like that one. And then like the zipper's good up and back towards the spine. But I always watch out for people then rounding into their low back because you don't really want to tuck the pelvis when you engage the transversus abdominis in isolation. So making sure that people maintain a neutral spine while they're doing that.
Yeah, it's not as necessary
Yeah.
as people think. You can do a transversus abdominis activation with a posterior pelvic tilt.
Yes.
Yeah, those cues are good. One that I like is even thinking like 2 gears, which I learned this from another one of our PTs at the clinic. 2 gears, one at your rib cage and one at your pelvis, and almost thinking like they're like turning into each other as you're like activating your core. That I'm usually doing while I'm observing people. And then also the important thing is cueing this on the exhale when I'm first working with people, because a lot of times people just want to like suck in.
Yeah.
You know what I mean? Like on the inhale. So if you force them, like when you're starting out, exhale and belly button to spine is obviously a common one. That will probably be confusing at first because people will probably want to go like inhale and belly button to spine. But if you tell them to exhale, they're going to be like, wait a second.
Yeah.
What does that mean? And you have to actually use your muscles.
Yes. Always on the exhale. It's going to help. And then another with belly button to spine, the other thing I emphasize is make sure you're not pushing the ribs out, because if they are, you know that they're engaging the wrong muscle. They're going a little higher into rectus and they're like trying to like do too many things at once. So if they start to activate and bring the ribs down, the only muscle that makes sense to activate is then the transversus abdominis if you want to like flatten the belly.
Yeah. And then my favorite thing out of everything we've talked about so far is literally just palpating on yourself versus thinking of like cues, and having the patient find their hip bones, the ASIS, right? Like the bony parts at the front of your pelvis, and then just going slightly medial or just like a slightly inwards to that and doing that brace, whatever cue works for you, and see if you can like slightly press in and then feel that muscle like pop in when you brace.
Yeah. Dig those fingers in a little bit because it's a deep muscle. So then you'll feel it really activate underneath the fingers. I love that. That's what I always give people.
That's the easiest, because when you're doing any kind of core engagement, you can just bring your hands to the middle, like right there, right by your ASIS, a little bit medial, find that core brace, do whatever it is, like a half dead bug. I do a lot, things like that. and see if you can find it and see if they lose that and then start to slip more into like an anterior tilt or something like that. Then it's easier to be like, wait a second. So this is a big thing I see like in fitness classes. They'll give us, so I take berries. I know we've been a hater on HIIT workout classes in the past, but I've been berries maxing lately.
Hannah's a fan.
I'm actually a fan. Anyways, so there are some classes that we take. It'll be like abs and ass or something like that. And we do like more intensive core exercises. And I'm literally looking around the room like, all right, none of y'all are actually activating your core. Because I know I am activating my core because I can feel it. But I can't fully drop my legs down and like do flutter kicks like that and feel like I'm actually activating my core.
No, I'm always modifying that shit.
No, I have to do like single leg or something. It's going to be more effective than like trying to do like this like crazy, like the hardest core exercise you've ever seen.
Yep.
You're not actually, I mean, you're getting some core engagement for sure. You're still working on your core, but like it could be more optimal.
There's just a lot more accessory use.
Yes.
To get those. I agree. I think that's, if we're talking fitness instructors, classes, that sort of thing, it would be, if it's working well, the exercise is going to be harder than it looks.
Yeah.
Like people are like, oh yeah, I do dead bugs in class all the time. And I was like, not like we're about to do them.
Yes.
And then it's always harder when we do them together because they're actually using the TA.
Yeah. So here's the thing with cueing, I would say is, okay, cues are terms used to help the general public, similar to delivering a baby.
Gen Pub.
So similar to delivering a baby, when, you know, a doctor will say, or nurse, whatever, will say, push like you're pooping, because not everyone knows what that feels like, or people do that incorrectly all the time. But generally speaking, that's like a similar sensation, and it maybe is the fastest way to give a patient a cue on like how to do something or how to bear down, right? But pelvic floor PT, we go a lot more like deeper into it. We find what works for you and what your pelvic floor is actually doing. Going back to TA cueing, that's like how group fitness is, like belly button to spine. It's a good cue, but you don't know what people are actually doing. But it's the cue that might work for most people. You know what I mean?
I do know. I also just changed my position like 10 times while you were talking.
That's okay.
I wasn't listening that well.
Thank you for your honesty.
You're welcome.
You're trying to slowly move to not hit the mic.
Yeah.
You probably still hit it.
I did.
I'm going to hear it in editing.
I know you're going to be so mad.
That's all right. But no, I would say pretty much what I said is just a general cue like belly button to spine or low back to mat is a common one, because your TA does activate. If you're activating your TA properly, like doing that posterior pelvic tilt, sometimes people can feel it better.
Yeah, if you want to add it to it.
Yeah.
You can also do it without that.
So yeah, like that works for like a lot of people, but not everyone.
Yeah.
Sometimes you need extra cueing.
Yeah. There's not going to be a perfect like group fitness cue for this, especially because most people have been doing core work a certain way for so long. It's a lot of unlearning too.
Yeah. You can do low back to mat without activating your core.
For sure.
You could just be activating your glutes or something, you know? Anyways, that's kind of like our favorite. Those are some tips. I think those are helpful. I do think, you know, sometimes it can be problematic when you like learn the wrong skill, you know, which I feel like sometimes can be taught incorrectly if people don't know how to properly activate their TA.
Yeah. All right. Period. Next.
All right. You want to read the next question?
For sure. Okay. It says, hi, I'm so glad this podcast exists. It's so fun and fresh to finally have cool girls talk about pelvic problems. Okay, so I got pelvic floor Botox in December, and ever since then, my orgasms were muted. In parentheses, I think because the muscles couldn't contract as easily. Anytime I looked this up, I didn't see anything about it, likely because no one cared about the female orgasm, but that's a story for another day. Yes. Have you heard anything about this? Any tips? Sadly, it might be a sacrifice I have to make for pain-free sex, but I love my orgasms, lol, and I don't want to sacrifice them for pain-free sex. Great question. I'm actually shocked that nothing came up when she Googled this.
Yeah, no, me too.
Or they Googled this. Because that seems like a no-brainer that would come up on Google. That yes, it probably can. Your assumption of the muscles not contracting as easily is spot on.
Yeah, no, 100. I mean, that you answered your own question there for sure. But I don't think that you have to sacrifice your orgasms.
Yes.
For pain-free sex. There's so many other things that you can do. The good thing is that Botox does fade. So, you know, there's that component. So you can see if that did play a role, because we literally just talked about earlier some other reasons for lack of sensation during sex or things that could cause your orgasms to be more muted. But I would say in terms of the Botox component, yeah, it's your muscles weakening. And part of an orgasm is a strong contraction of your pelvic floor muscles on top of other things like hormonal cascades and things like that. But
yeah. I would say, I don't know if this person has ever done pelvic floor therapy, but our advice to someone getting Botox for pelvic pain is that it's really good. It's really effective. We just did an episode on how we like it, but its best way to be used is in combination with manual or pelvic floor therapy or exercise, something that's going to work on the pain long term, because Botox is going to be a quick fix and temporary, right? So once that wears off, it might slowly get better over time, but the goal would be that you don't need that permanently, that you're using it in conjunction with another treatment that helps that pain dissipate long term. So in that sense, you definitely don't have to sacrifice your orgasms, because if you eventually do the work to not need Botox anymore, whether that's through pelvic floor therapy or some other exercise-based modality, then you won't have to get it and you won't sacrifice them.
yeah, that's why and maybe you did try pelvic floor PT before, but that's why we say use Botox. Don't use it as your first line of treatment. There's more less invasive options to treatment of pain-free sex that are sometimes even more successful than Botox.
For example, if you went to pelvic floor PT that does dry needling, if you're having a benefit of having some like muscle deactivation in that area, I am curious what like pelvic floor therapy would do for this person.
Yeah.
If they even did trigger point releases, dry needling, and then some down training, just to see how they might respond to that.
Yeah, nervous system, working on your nervous system, dry needling. Try some dry needling if you haven't. Work on your breath, internal work. There's so many things.
Totally.
So many things that you can do.
So many things.
So try those and then let us know.
Yeah.
Let us know. But you do not have to sacrifice your orgasms. I don't want you to think that.
I hate to see an orgasm get sacrificed.
Everyone has a right to an orgasm, okay?
Everyone has a right to a good orgasm.
Exactly. Okay, we're going to move on to our next question. We have 2 more, guys.
Okay.
What are your favorite period products to use? I've used tampons forever, but sometimes I forget that they're in there, or I just leave them in way too long. I'm also terrified of toxic shock syndrome, so just wanted to try something new. Thanks, freaks. XX.
Relatable.
Yeah.
I always freaked out about toxic shock syndrome in high school and college when I was still using tampons, because I was the person, so true. I was the person that left them in for like a full day. One time I did try to put one in on top of another one. Thankfully I caught it.
That happens a lot, actually.
Yeah. Flex disc all the way though.
Flex disc is my number 1.
Yeah.
And I tell every single patient, I tell my friends, I was at an engagement party recently and I was talking to someone and they came up to me and they were like, you helped me so much with navigating UTIs. Like I never get UTIs anymore, whatever. It was like one of my friends from PT school. And I was like, that's so great. And she was like, yeah, your tips with like changing my tampon more frequently was really helpful for me, because she was changing her tampon, but just not as frequent. I was like, try changing like literally every 4 hours or like more on top of that. And just not leaving them in as long, or every time you pee, like change your tampon if you're more susceptible to UTIs. And she was like, that was game changing for me. And I was like, girl, more game changing for you will be to use a flex disc. And she was like, really? No, I'm scared. And I was like, dude, it's so much better. And I had one in my purse. I was like, take it. And she was like, wait, no, I don't want to take your flex disc. Are you on your period? I was like, no, I don't even know I have this right now. Take it. This is for you. It's a sign that you need to transition to a flex disc. And she was like, okay, fine. I was like, please let me know how it goes, because it changed my life.
Literally.
I tell everyone there is a learning curve with it. I would say if you're first trying a flex disc, wear like a liner or something for the first week, unless you're like me and you like actually don't care about bleeding through every now and then.
Yeah.
But if you really do care and you're nervous about that, put a little liner in or something. And honestly, it's it's one, invented by women. So that we love that. Two, it helps with your period cramps. It's shown to help with period cramps.
That's cool.
So it's big, like it's like a big circle, but you pinch it and it goes down to like the size of a tampon. And the way you have to insert it, you have to like insert it like at an angle, and then it sits above your pubic bone, and it actually stretches and puts pressure on your pelvic floor muscles in a way that helps with relieving cramps.
Interesting.
It's not going to like completely change if you're like, you know, have really painful periods, or you have, and like there's going to be more work you need to do. It's not a magic fix all, but it can actually help with period cramps. Also, you can wear it during penetrative sex. You can wear it with penetrative sex with a penis, whatever it is, and oral sex, and it's not messy.
Yes.
Like you can literally go to your hookup and not worry about like, oh, I got to go take my tampon out, or like whatever it is.
Can I just say, I just traveled and I had a lot of sex on this trip, and I got my period as I left this trip, and I was like so bummed about it. But I have the Flex Disc, not a single drop all weekend.
No, it's
not
amazing.
A single drop. And that's happened on 2 different trips now. One was like maybe a year and a half ago, and that was one of my first times using it, and it worked right away.
Yeah.
Like you literally would not know you're on your period, and that's the biggest thing, because when I first stopped using tampons, I was a sophomore in college. I switched to the Diva Cup, which I did. I was a cup user for probably 7 or 8 years, like through grad school until a couple years ago. And I loved it, but you do have to empty it more, and you can't have sex with it in because it blocks your vagina.
Yeah.
So I would have to take it out for sex. So sex was still messy. And the Flex Disc, I truly could forget about it for a week. And it like does self-empty if you pass like a bowel movement or even sit down to pee. Like if I'm in the right position, it'll like let some of the blood flow out. So I would say that's the big learning curve, is like you will see blood when you go to the bathroom, but that means it's just like emptying itself. And it just would like refill and do its thing, and I barely had to change it.
Yeah, guys, you can literally leave it in for 12 hours.
Yeah.
You can leave it in for 12 hours and it self-empties, like Amanda said. Every time you pee, there's going to be like some blood in the toilet.
And if you're like me and Hannah, you can leave it in for 48 hours.
Sometimes I don't recommend that. Don't tell them that. Shame.
I have gone 2
We're
full
disgusting
days.
sometimes. Don't do it, because you guys, you could still get a yeast infection if you leave things in there for too long. You don't clean it out. If you have sex with it in and they come inside you, like you need to clean that shit out. Like we recommend every 12 hours. Have there been a time where we forgot? Yes, but we're disgusting.
We're disgusting. I would leave the Diva Cup in for 24 hours too.
Yeah.
And I think that one is only supposed to be 10 or 12.
Yeah, so there you go. But there's been a time I forgot about it. Literally just, this is why, because you feel like you're not on your period.
Wait, can I tell you a really funny story?
Sure.
I was at a dance party in LA with my friends, and it was like at a club, and I accidentally flushed my Diva Cup down the toilet.
What happened?
I took it out to empty it, and it fell in the toilet.
No, like after.
Oh, I used toilet paper for blood.
Oh,
No, the toilet was
piping?
fine.
Okay.
At least from what I saw.
Here's the thing. I was in a sorority in college, and you know, they always have those signs that's like, don't flush your stuff down the toilet, right? And people fucking do it all the time anyways.
No, this was a reusable silicone Diva Cup.
I know, yours was accidental. This was not accidental. People were flushing their tampons. They didn't give up. Okay.
Oh, no.
And one day, one tampon too many, I guess, some girl flushed that toilet. I still don't know. I actually don't know who it was. I remember at the time, like she was known as like the person who flushed the tampon down the toilet that like flooded the basement.
Oh my God.
The entire sorority basement flooded, but like thousands of tampons like exploded from the toilets.
That's horrifying.
It like backed up the pipes so hard that like tampons were just like, if you had like an animated movie, there would be just like tampons everywhere, like used bloody guys, I'm not kidding.
That's
so
horrifying.
Don't flush your tampons down the toilet. Like that can really fuck someone up.
Yeah, I'm so stressed about having to do the bathroom maintenance at the new clinic location, because I'm like, right now, if people are doing that, it's the building's problem.
Yes.
Once they're in our space, it's our problem.
We're gonna have Flex Discs instead of tampons. Like, here you go.
For real.
But the other thing is that they do have the disposable option if you're like me and have ADHD and you like can't be using reusable stuff, because then that's just another thing you have to think about. They do have the disposable option, but then they do have the reusable option where you can clean it.
Can I tell you a secret?
What?
When I was before college, when I would use tampons, when it said like don't flush your menstrual products down the toilet, I thought that was just for the wrapper and like the tampon applicator. And I always thought the tampon itself was supposed to go in the toilet.
Yeah.
So I did that for like 3 years before I realized.
A lot of people do it, dude.
It was wild. They don't make that clear enough.
Well, also, like, it's gross when you gotta, like, this is why I hate tampons too. You gotta take your bloody little dead mouse out, and then you gotta wrap it up in the toilet paper.
And then get blood all over your hands.
And get blood all over your hands. You're touching the pee string, which smells disgusting. And then you wrap it up and then you leave it in the toilet. Let's say you're at your man's house, and then there's just like and it soaks through the tissue paper. You look in there's just like a bloody tissue paper, like you cut your finger off and then just left it in the trash can.
Listen, I'm so glad you said this, because the main comment I get from people that are avoidant of the Flex Disc or Diva Cup is that they don't want to like touch their own blood. And I'm like, are you not touching your own blood with a fucking tampon? Mm-hmm. Listen, I don't care what anyone does. If you prefer tampons, use them. I don't give a shit. I prefer the Flex Disc, and it's not messier, and it's amazing. Mm-hmm. And you can have great sex with it in.
And obviously, if you can't like insert anything into the vaginal canal, like you can use a pad. Those are fine too. But like if you are using tampons and want to make a switch, this is what we recommend. Another thing I was going to say, oh my God, I lost it. Okay, another pro of a disc of any type, you can save your period blood and use it for like spells and stuff.
Oh yeah, you can water your plants.
You can put it in your plants.
And
like you can do all of that.
Spray it on men.
I had someone tell me they want to take their placenta and bury it in their backyard. And I was like, yes, that's so cool.
Wait, that's really cool.
I know.
I don't know what would happen, but that sounds amazing.
It sounds amazing. You could like plant a tree or something.
Yeah.
And then it would be fed from the nutrients of your placenta.
I'm going to make the pills though, I think, out of mine.
But what's the research on that? We got to do it.
We got to do the research. If it's good, I'm doing it.
Because I don't know if there's an actual benefit. And then this is a thing that someone else told me, is that they didn't like the idea of taking something that is expelled from your body and putting it back into your body if it's meant to be out of your body.
Interesting.
So I don't know. That like got me thinking.
That is interesting.
You know what I mean?
Yeah.
So I mean, this isn't, guys. This is just us yapping. We haven't done like research on. If you guys have a question about the placenta stuff, we'll deep dive research into that.
I think we should actually. I'm so interested.
Yeah.
I would drink breast milk though. My friend's breast milk tasted like vanilla milk. It was so good.
Interesting.
We all took a shot of it. It was amazing.
Yeah, people do that.
That expelled out of her body.
Yeah, it did.
But it is meant for consumption.
Okay, last question.
Is it normal to have pain for the first 10 seconds of sex and then it feels normal after? Hannah, what's the answer?
Normal, we don't like that word, but it's common. Yeah, that happens. That does happen, but it's not something that should happen. Mm-hmm. So what you're describing is entry pain or superficial dyspareunia.
Ooh.
Which is entry pain. With
like,
penetrative,
how else are you going to describe
with
this?
penetrative sex, all right, or penetration.
Yes.
Okay, so this is a common thing we see people for, and it can get to the point where entry pain is not painful. Mm-hmm. This is when the device like the Kiwi is super handy, because you can warm up for sex by doing some stretching to the first layer of the pelvic floor.
Yeah.
Kiwi by the Pelvic people.
I love that you said warm up, because I think that really is the answer to this question. Mm-hmm. It's warm up in whatever capacity. Is that foreplay? Is that breathing? Is that a device? Is that dilators? Mm-hmm. It's what's going to help with the intro pain, right?
Yeah.
Yeah.
Introductory discomfort. And it could be to a point where we use dilators for circumferential stretching, a pelvic wand in your little desk drawer. Mm-hmm. Desk drawer?
Okay.
Nightstand.
Yeah.
It can be on your desk too.
We're getting weird. Guys, we've recorded a lot this weekend.
So, is it normal to have pain for the first 10 seconds of sex and then it feels normal? No, it
Short
is
answer,
not.
no.
We got to make that shit pleasurable for you at all times, including the first 10 seconds.
Unless you like pain.
Unless you want some discomfort or
We're
something
not pain
like that.
shaming. If you have a pain kink.
But if you are not wanting that, then you don't have to have it.
Yes, and it's not normal, but it is common.
Okay, so that is our last question of today, Pelvic Freaks. And I know you guys love these Q&As, so please keep submitting questions because we love them.
And every time we say people are asking such good questions, we get more amazing questions. And you guys are just asking us really cool, unique not unique, but specific topics that we really love to talk about. So we appreciate that.
And coming up, we have another guest joining us. So we're super excited for that. Stay tuned.
Stay tuned.
And then anything else coming up? Nothing that you guys need to know just yet.
But Pride's almost over, so everyone get a little bit gayer right now. I don't know what you've been doing, but it's not enough. And make sure you're following us on social media at The Pelvic Freak Show. And that's where you can submit a question at the link in our bio or through our DMs. We're always looking at those. And if you loved this podcast or just love us in general, which how could you not? We're wearing red. Please leave us 5 stars. It helps with outreach.
Bye, Pelvic Freaks.
Bye, Pelvic Freaks.